And what I want to get into here is the level of sort of, Sana, you touched on it with sort of the welfare rights as we get into industrialization and things of that matter. At what point, and you mentioned this as a lot of you mentioned this as well about overstepping and finding the right balance. What for you guys is sort of the right balance of government as far as we'll say we'll use healthcare as an example. Um, I know a lot of like free healthcare has been thrown out like that term. At what point? Because the other side would say, well, it shouldn't be employee provided at all. It should be a total free market, and you should take the middleman, the insurance companies out of it, and you should be able to kind of have the free market, and the competition would drive prices down. Whereas the left would say, well, if the government were to provide it, then you wouldn't be broke every time you went to the hospital because they're charging these exorbitant prices. And so I want to get your guys' kind of feelings on using that example of what do you guys think the right sort of solution for a problem like this would be? Because I think all of us can agree that we shouldn't be going broke every time we go to the hospital, or insulin shouldn't be however expensive it is. I know I've got
$100 a vial.
yeah, that too much, right? I think we can all agree, but what we disagree on, maybe not all of us here specifically, but generally the population disagrees on what exactly do we do about that. And so what would the role of government be in this solving this sort of problem? Um, and how would you go about doing that? We can start with you, Sana.
Yeah, I think a government funded option, not the only option, but one of the options actually helps with that competition. So I think when you're looking at different insurance companies, they, for the most part, have similar rates. They're striking some type of deal with your organization if you have some type of program through where you work. Um, but those rates are still pretty high. And if you don't have an option available from where you work, like why not have a government option where it would essentially serve as an additional competitor for a private organization? So just if you look at how many people were uninsured before Obamacare, whatever you want to call it now, it was at an alarming rate. We've seen that rate go down, but we've also seen the opposite effect where some people were driven out of the insurance plans that they had because the government put in these sort of regulations that private insurance wasn't enough. It wasn't covering enough. Um, so I think they just need to go back to the table there and say, like, if you want to have whatever minimal plan you had through your private organization, go ahead and do that. If you want to have the government funded option, it shouldn't prevent you from having either. I think both should be on the table, and hopefully as they continue to work on Obamacare, it'll continue to just get more competitive and be able to cover more. But I think if you can opt out of Obamacare and you can go with a private option, then that should be something that you should be able to consider.
Absolutely. Will or Theo, do you have anything to kind of say to that? I know, Will, when we talked before, when in many of our conversations before,
Mm.
we've kind of been, or you at least have been on the side of opposing it from the standpoint of quality of care. It would be like going into the DMV of a doctor's office, and we all know the DMV lines are forever. Um, do you have anything to kind of add or say to that?
Yeah, I mean, for government funded healthcare, I would think that should only apply to certain individuals, that are still kind of they're struggling, or they're in a certain predicament, or there's some type of circumstance where they require that. But for me, I would just say like when you have government funded healthcare, nothing's ever free. Like there's always some type of pricing for it, or something gets taxed, or it comes out of someone's paycheck or something. There's always a trick to it. So always have to ask the questions like, well, if you have government funded healthcare, for instance, like, are you going to be able to be able to see the physicians you want, and get the healthcare that you want, and also the rates and the premiums, like what are those going to look like? Are they going to be super, like, super affordable, and all the other costs that come with, healthcare when you go like hospital bill and stuff like that, like what's going to go on with that? Like there's not really a plan. You just say, oh, like free healthcare, but you're just not really a plan afterwards because like it's not something that we're used to because we're always used to the free market type of healthcare system that we have that's in play now. But another thing is the big thing for me is just like if it's government funded, how is it going to get funded? Because nothing's ever really free, especially in the system that we have now. So that would just be my biggest question. Because I'm not opposed to it at all, but you have to raise those questions because you have to know, like, you want to know what's going on, where the money's coming from, and if it's coming out of your pocket, it's going to be a concern, for everybody, and just a typical average American taxpayer. So,
Devin, do you have a sort of solution to that, to the questions that he brings up, or anything to add to what Sana said?
So I definitely agree that there needs to be something done in regards to having another option and a more affordable option for people with their health care. Like what Sana was saying, like if Obamacare, that people will actually, if once it has more time in the actual pipeline and gets more funding and more people actually are on it, I feel like it'll prove itself that it actually works. And I don't know, it's tricky for me because I can see both sides. I understand that if we have universal healthcare, things will end up being like Canadian healthcare where like, everybody has access to it, but the wait times are going to be ridiculously long. And if everyone, I know I was born in the Fredericksburg area and I know how Mary Washington Hospital used to be. And the hospital, not saying that they had free healthcare, but the waiting room and the wait times were ridiculous. And I just feel like if we have a system in place that is just completely free healthcare, it's going to revert back to that system. So we need to have something that's a little bit more streamlined, but at the same time, it's not going to break you anytime, especially with a pandemic, it's not going to break your bank anytime that something happens.
For sure. Theo, do you have anything to add or respond with?
So it's an interesting topic for me, especially because, growing up in a military family, my dad was in the Marine Corps. After I graduated, I enlisted in the Army, ended up going to West Point. Healthcare really wasn't a major concern to me. And I think that just because that for that particular instance, that it wasn't as a problem for me as it was for other Americans, that means that someone like me needs to raise my hand and say, hey, what are we doing? Like how I have affordable healthcare because the military pays for it. So what are we doing for those Americans that aren't military? How are we handling it DOD wise? Is it coming directly out of our paycheck? Yes and no. Taxes, where's the money coming from for civilian healthcare, as we call it in the military? Most of the time it was taxes, but not always. So I have to agree with Sana. I like the multiple options. Devin, I'd like to say that, I agree with you. I think it needs to be more affordable options. And then we definitely need to have answers on where the funding is coming from. Are we going to increase one thing and make that a burden for Americans or for a larger or whatever size group of Americans just to decrease the need for healthcare on this side? Or can we find that balance? Right. But at the end of the day, healthcare is a given. That's the government's role to take care of their citizens. So it's a big problem. It needs to get solved. It needs to get solved fast. So that's what I'll have to say about that.
So you talked about striking a balance. What would that balance be for you?
Not overburdening one sector, like increasing taxes to a point where now folks can't even afford other insurance type things like homeowners insurance or car insurance. Now they can't drive a car because their car insurance is so high, or they have to pay this much, or taxes. And you can't take from one and think that will be okay over a certain time frame and give to another area and say we fixed it. You didn't fix it. It's going to be a problem down the road. So that balance is, I guess it's more of a risk management concept. you're going to have to look at what's the risk of increasing this item or this agenda or this aspect of government or this aspect of our citizens' needs versus decreasing this and not causing the balance to tip one way or the other. I mean, it's kind of hard to explain. I'm no politician, but again, I mean, that's what we're paying, or that's what our politicians are getting paid to do, figure out these problems. So, I mean, the waiting game begins now, I guess. So,
Sure. Devin, you're in the medical, we can call it the medical field. What do you see when you talked about the difference between Mary Washington Hospital from before to now, and sort of when somebody gets hurt and you're on the scene, like
So
you were talking about Canadian healthcare earlier versus the American one. What kind of things do you notice? And if you're taking a patient in, right, somebody gets hurt on a construction site or whatever, you're taking them in. What is the process like for you to, as far as, or what have you observed as far as like the paperwork insurance side of things?
So I've worked on a county ambulance as well as a private ambulance. So the county, their policy is to take you to the nearest hospital. But if you request a certain hospital, say that if I want to go, I have an asthma attack, the closest hospital I am to is Spotsy Regional. If I tell them, no, I want to go to Mary Washington Hospital, it is 4 or 5 miles further, but that's going to be an extra charge because of
from the private one, right?
Right.
Yep.
And then even from the private one, we won't even pick you up until your insurance has cleared the trip. So you can be on a certain, like a ventilator or something like that. But if your insurance says that, hey, they don't have a bed ready for you, you have to either wait or take them to another hospital. So, and I've had to do that on numerous trips, and it made me feel like I couldn't do the best that I possibly could have done. And it made me feel like they shouldn't have to choose that. Like if you're in that type of vulnerable state, you shouldn't have to be worried about like, well, damn, like is Kaiser really going to pick this up if I decide to call 911? You shouldn't have to worry about that. You shouldn't have to worry about like, oh, I need to go to a hospital that's up in Nova because no hospitals in Spotsylvania have a bed for me unless you go to Stafford Hospital.
Mm-hmm.
So it's a lot. And then not to mention, once you get better, how are you going to get back home?
So what's the difference between the private ones and the county ones?
So the private ambulance, everything is worked off of what your insurance pays. We have there's a flat rate based on the service you need, whether it's BLS, basic life support, or ALS, advanced life support. And that pay varies as well as what you may need. So if you have a critical care patient, who's a patient that's on a ventilator, patients on a heart monitor, anything like that, then that pay is going to go up as well. Now, granted, a lot of these people that are on you'll have, and then sometimes it'll change mid transport. So with private care, you will end up getting a bill that will fluctuate depending on what the situation is. Whereas with the public county, you're gonna get a flat rate, and now with your insurance, you get that paid off. I actually have a bill from Fredericksburg, and that was going to be like $700+ just to go from downtown to Mary Washington. But luckily, my insurance kicked in, so I have to pay $50. But you don't really have that fluctuation because it's a little more regulated because you're paying taxes to the county, and the county is getting paid through that. But with the private, like I said, with the private, they set their own prices, and then they can change based on what your condition is and how your condition varies and how far you need to go.